This project is aimed at enriching chest X-ray diagnostic capability for the monitoring of COVID-19 patients. PACE has been carried out by a consortium of public entities, including the National Institute of Geophysics and Volcanology in Rome, Italy, the University of Messina in Italy, and the University of Catania in Italy as well. The project has been funded by the Italian Ministry of Education, University, and Research. And you can see in the bottom right corner the official link to this project. My name is Giulio Siracusano. I am a data scientist with more than 15 years of experience in research and development activities. And today I'm going to guide you through this project. Well, first of all, in this slide, we are going to see an overview of the topics we are about to touch during this presentation. First, we will discuss about what is the motivation behind this project, why this project is so important to push forward the current diagnostic capabilities using chest X-ray and bringing effective results in the diagnosis of pulmonary diseases. Examples of enhanced chest X-ray images will be provided and compared against traditional chest X-rays. Moving on, we will introduce the concept idea, which is on the basis of PACE. And that description of the algorithm will be provided as well. Then, we will discuss about the metrics we have used as key performance indicators to study the capabilities of PACE. And the results will be shown and evaluated against other state-of-the-art methodologies. Finally, I will present you with an actual use case which highlight how PACE can significantly impact the way we screen, monitor, and diagnose pulmonary diseases by considering either COVID-19 and non-COVID-19 patients. Lastly, conclusions will be drawn. So let's get started. Today, pulmonary diseases are one of the major causes of mortality in the world, and chest X-ray, or FISR for short, is the most common screening technique in the investigation of multiple pulmonary diseases. FISR advantages include low cost, wide availability, ease of use, and especially its minimal radiation side effect, if compared again CT scan, for example. Nonetheless, FISR images interpretation is challenging. FISR often is affected by low quality issues. These are because of the acquisition mechanism or because of the environmental noise. For example, if you are into an ICU, or if you have non-collaborative patients, such as, for example, patients who are very sick. And every of these elements has an implication which might have a detrimental effect on the quality of the resulting acquired chest X-ray image. A correct interpretation requires a wealth of medical information to confidently diagnose and document findings. In this way, enhancement techniques are evolving, but are still prone to some detrimental effects, such as, for example, image artifacts. That's why, with this in mind, PACE has been implemented to provide robust chest X-ray image enhancement in an automated manner. So, in this slide, I'm going to show you how we can consider two different chest X-ray images from COVID-19 patients. These COVID-19 patients have been evaluated in the study, and these patients are affected by bilateral pneumonia. So what do we expect from the analysis of the original chest X-ray image is that we should be able to see the areas with pleural effusions, but this specific diagnostic activity is difficult because of the reduced brightness of the image. And of course, even the details are hidden because of the low contrast. So that's why if we should expect some pleural effusions in the areas indicated by the arrows. But in order to make these areas and the details more visible, we can use space. So thanks to that, we obtain two different and more enhanced representation of the original images, where these areas are even more visible, and we are able to provide a very accurate demarcation of where the pleural effusions are located. So moving on. What is the concept idea behind PACE? PACE has been developed with an idea in mind. The idea is to reach multiple characteristics of the chest X-ray, such as, for example, contrast, noise level, and brightness at the same time. And this is meant to improve the interpretability or perception of the information that is contained in the chest X-ray image. In order to make this happen, we use a combination of multiple techniques together to improve the visual appearance, such as, for example, we remove luminance inhomogeneities and noise from the image. And we also apply contrast enhancement techniques on the image to provide even more details. In order to make this happen, PACE explore different processing methodologies, which are applied to correct independent aspects of the image, such as, for example, denoising, luminance correction, or contrast enhancement. And they will see any of them in a bit. So let's discuss about what is the algorithm. Well, PACE, as said, uses a multi-steps approach. This approach combines different methodologies. First, we identify what is the input file. This file might be a DICOM image as obtained from a scanner system, or it might be an image. This input file is acquired and preprocessed. Then the image is decomposed using a methodology which is called FABMD, and this methodology is meant to divide the image into a number of independent components. Each of these components is another image itself. And at the end of this process, we have the original image is decomposed into a finite number of other components, plus a residual image. This residual image is very useful because it provides information about the bright areas of the background of the chest X-ray image itself. And it is very useful because what we do is we take this residual image and we perform another step of the processing pipeline for PACE. And this step is called homomorphic filtering. The homomorphic filtering, and we will see that in a bit, is able to correct the residual image and improve the overall results at the end. So what happens next is that we reconstruct the image by combining the individual components plus the filtered residual image, and we use this intermediate result to perform a contrast enhancement using CLI. CLI is another methodology we will describe, which is meant to perform contrast enhancement. And what happens next is that the result is evaluated multiple times by performing an iterative approach, which is meant to find the better combination of parameters by reiterating steps 2 and steps 3 of this methodology. Once we have completed this process, the best results we have by taking into account the metrics we have considered in the study, in the project, will be used, and an output, an enhanced chest X-ray image will be generated. Moving on. Well, let's discuss a little bit more about what is the image decomposition. So FABMD is the acronym for Fast and Adaptive Bidimensional empirical mode decomposition. This is an adaptive methodology which is data-driven, and it is very fast, very computationally efficient. The main results of this methodology is that the input image can be decomposed into a number of multiple hierarchical components that are called bidimensional intrinsic mode functions, or BIMFs, and a residual image. All these components plus the residual image can be combined together and generate the input image. The nice part of this methodology is that this is a sequential method, which means that the order of the composition, the order where each of these components is extracted from the original image, matters. So, for example, low order components bring noise, but also very, very tiny details of the image. While moving on, higher order components bring the contours of the image and also the local structure. And then at the end, the residual of the image provides information about what is the bright and what are the bright areas of the image. And is very useful to mitigate the occurrence of artifact effects. Moving on, what we do is to take the bidimensional residual image from the previous step and perform homomorphic filtering. The homomorphic filtering is used to improve the appearance of a grayscale image by compressing the range of intensities of the image itself. So what we obtain is that we remove the presence of luminance inhomogeneities of the input image, and the overall result is an image which is much more uniform. So if we use the result of the bidimensional residual and combine and evaluate what happens on an actual chest X-ray image, we can see that the original chest X-ray image, once it is filtered using homomorphic filtering, keeps all the details of the original details, but at the same time reduces the oversaturation of very bright areas, because these areas might have an effect in the generation of artifacts. That's why we use this methodology. And the mathematical formula behind the homomorphic filtering is visualized in the slide. There are two key parameters, GL and GH. These parameters are related to the response of the filter once applied to the input image. And these parameters are used in the iterative study as we described it so far. Well, moving on. Once we filter the bidimensional residual image, we combine this filtered residual plus the other components from the 5BMD decomposition, and we generate an intermediate image. This image is used as an input element for the contrast enhancement block. This contrast enhancement step is carried out by means of CLI. CLI is the acronym for Contrast Limited Adaptive Histogram Equalization. The nicest part of this methodology is that it is very, very efficient, and it is well known in literature. It is considered a well-established reference approach. What CLI does is to take an input image as a reference and divide the image into a number of finite blocks, and for each blocks perform independent contrast enhancement on each of these blocks. So at the end, the final result will be the combination of these consequent, these non-overlapping blocks, all combined together, which at the same time provide whether better contrast, but also very well-defined details which are preserved using this methodology. And the last part, which is useful to highlight, is that because of the homomorphic filtering, we are able to mitigate the occurrence, the generation of artifacts, because we are able to control the areas which appear to be very, very bright. And this, of course, has implication in the way we are able to preserve the details and, of course, enhance the interpretability of the the resulting chest X-ray image. In terms of key metrics, we have considered different metrics to evaluate what are the performance what are the performances of these methodologies. And these metrics have been widely considered in other research contributions. We have considered three metrics which provide a quantitative representation of an enhancement, and these metrics are such that an higher number means that the result, the expected output is better than the input. The first metric we consider is the entropy of the image, which provides an idea about how much information is contained in the image, in the resulting image. A contrast improvement index is another metric that is considered, and we have the formula visualized in the slide. This metric is meant to compare together the output against a reference image and provides an idea about how much improvement is calculated by comparing input and output. Last but not least, we have a more recent metric, which is called measure of enhancement, or HIMI, and this measure of enhancement has been demonstrated to be successful to evaluate the enhancement on some applications, including some types of medical imaging. Well, if we focus on the results, PACE has been evaluated, and the results, of course, have been published. We have the paper visualized. The proposed methodology has demonstrated to be better than several state-of-the-art techniques. But if we just focus on the left part of the slide, we can see there is a picture where PACE has been compared by considering the three different metrics against CLI, which is a standard methodology. And as we can see, on the whole data set of 79 patients affected by COVID-19 that have been considered for this study, PACE has been able to outperform CLI on all these patients. The interesting part is that if we give a look to the baseline chest X-ray image on the left, we can see that the image itself is very low in terms of contrast. And when we apply the CLI methodology, we get a better contrast for sure, but we also are not able to visualize all the details that are hidden because the results is still quite dark, especially if we take into account the area that is magnified to show how the results are preserved and how the contrast is improved as well. On the right part of this picture, we can see the result as obtained using PACE. Even in this case, we have a better contrast if compared to the baseline chest X-ray image, but at the same time, the results are more visible. And this, of course, improves the way we can interpret these results and, of course, improves diagnostic capabilities. Last but not least, we have performed a more extensive study using 163 different FISR images from patients affected by different pulmonary diseases, not just COVID-19. And we evaluated the result using entropy and contrast improvement index against other state-of-the-art methodologies. And even in this case, PACE has been demonstrated to provide better results and better contrast. So moving on, I want to show you right now different example of actual use cases by focusing, for example, in this case, on COVID-19 patients. For these patients, we have a baseline chest X-ray image, which shows a large peripheral pneumonia in the left lung, as indicated by the arrows, but no lesions have been identified on the right lung. The interesting part is that by using PACE, we've been able to generate an enhanced chest X-ray image where all the lesions that have been identified on the left lung are preserved, but we were also able to identify one lesion on the right lung. And these lesions have been confirmed by another CT scan that has been performed on the same patient. So the CT scan confirms the presence of both the large left lung lesion, but also the small focus of pneumonia in the right lung. So PACE for this patient was able not just to confirm all the lesions that were already visible from the chest X-ray image, the input image, but also identify new lesions. Moving on. This is another very interesting example. In this case, we have another patient, another COVID-19 patient, but in this case, the baseline chest X-ray do not provide any lesion with enough confidence. So what we have done so far is to calculate again using PACE an enhanced chest X-ray image, and we were able to identify a small lesion on the left lung, and this lesion was also confirmed using a CT scan. So in this particular case, the method we proposed was able to identify a lesion that was not available was not clearly diagnosed in the original chest X-ray image. And this lesion was also confirmed using CT scan. Moving on. This is another example, but this time we are not taking into account COVID-19 patients, but these are pulmonary patients, non-COVID-19. In this example, we have a baseline chest X-ray image for a patient who has been hospitalized into an intensive care unit after having a thoracic trauma, where expected pulmonary contusion were not found with enough confidence from the original chest X-ray image. And of course, we were expecting to find something about that. What we had done is to calculate again an enhanced chest X-ray, which is visualized in the center of this image. And in this chest X-ray, there was enough evidence to identify the contusion on the left lower lobe that can be clearly seen. And in addition, we have performed a CT scan, which perfectly confirmed the position of these lesions with the enhanced chest X-ray image using PACE. Last but not least, we have another example. Even in this case, this is a pulmonary patient, not a COVID-19 patient. And in this patient, this patient was with hemoptysis, where a nodule was suspected in the right upper lobe, but there was not enough evidence of the extension of this nodule and even the position. So what has been done is to calculate the enhanced chest X-ray using PACE. And it was also able not just to better identify the details about this node in this nodule in the right upper lobe, but it was also possible to identify the extension of this area. And this area was consistent with the CT scan that has been performed on the same patient. So the CT scan confirmed the speculated nodule in the left lung. The interesting part is that this patient has been subjected to a biopsy, and this nodule produced a and for this nodule, it was diagnosed as pulmonary adenocarcinoma. In summary, we have developed a post-processing tool to enhance chest X-ray images for the detection of lung lesions. These results are generally applicable to image enhancement. PACE enables a faster detection of the lung lesions. In 8 cases, it was able to highlight additional lesions. And in 3 of these 8 cases, lesions have been detected in the output using PACE, while were not visualized in the input baseline chest X-ray image. The clinical findings have been evaluated by 3 independent radiologists. And in addition, CT scan verification confirmed the achievements observed in the enhanced chest X-ray images. Furthermore, PACE performance has been evaluated using 3 well-known metrics, and this tool can support the analysis of different pulmonary diseases, including COVID-19, by enhancing the readability of chest X-ray images as obtained using portable X-ray equipment. And in addition, can deliver also the capability to monitoring patients, even if they are into intensive care units. And last but not least, research is ongoing to introduce further enhancement. So if you have any questions, please write me an email to giuliosiracusano@gmail.com, and I will reply to you as soon as possible. Thank you for your attention. Bye.